And the Prime Minister speaking out about the terrible tragedy, what's being called one of the worst mass shootings in Canadian history. Now, this prompts some very difficult conversations, especially with children. Joining us now from the Centre for Addiction and Mental Health is the Chief Medical Officer for the Suicide Crisis Helpline, Dr. Allison Crawford. Dr. Crawford, thank you for making the time. Let's start here tonight with how people even begin to explain something like this unimaginable tragedy to a young person.
Yes, well, first, I think we're all really reeling and responding to the event with shock. And it's very devastating, particularly for the families and communities involved for Tumbler Ridge. So I think we all feel that. And of course, children and youth are also going to have responses to that. It's important to create space for connecting with the children and youth in our lives. And some of that might involve conversation. But just our presence, taking care of our own mental health so that we can be present in a calm, supportive way, recognizing that children may be distressed, and also you asked about how do we talk about it, I think being guided by their questions. So we can often start, especially with youth, asking them what they might have seen or heard, what they might be aware of, asking them if they have any questions, and really being guided to give simple answers to those questions, and making sure, kind of having an eye on the media that they are consuming. Young children should not be seeing any media footage of that. And we also have to recognize that for older youth, that media can be very distressing. So that can be a focus of conversation as well.
In your experience, what might a question be that a child brings forward?
Well, I mean, I think children often, they can have a lot of empathy and be worried about those involved. They can also worry about their own safety and want reassurance that the people in their lives are going to be there. And that's one reason why conversation is important, but so is keeping up their regular activities and structure and being available to them so that it reassures them that they have stability and support in their own lives.
We now know that the suspect died from a self-inflicted gunshot. So how do we speak to our children about something like suicide?
That's a very good example, because I would immediately have concern that children and youth are going to be exposed to that through media. And hopefully, media and reporters are very aware of safe reporting guidelines, and any details that are provided can be extremely distressing to people. So I wouldn't be sharing those details with children and youth. But of course, if they have questions, I would just answer them very simply and focus on their own reactions and their own concerns.
Okay, appreciate your time. I've been speaking with Dr. Allison Crawford, the Chief Medical Officer for the Suicide Crisis Helpline at CAMH. Now, a reminder, that hotline, 988, those are the 3 digits. And if you or someone you know could benefit from this conversation, it'll be posted on our website, ctvnews.ca/Barrie.